In emergency situations where severe bleeding occurs, a tourniquet can be a lifesaver. It's a device used to apply pressure to a limb to restrict blood flow, preventing further blood loss. Understanding how to use a tourniquet properly can make the difference between life and death. There are two main types of tourniquets: commercial and improvised. Commercial tourniquets are designed for safety and efficiency. They're widely recommended because they are tested for reliability and ease of use. On the other hand, improvised tourniquets can be made from available materials in an emergency. However, these are less effective and pose higher risks if not applied correctly. Knowing the pros and cons of each can help you make the best choice in a critical moment. A tourniquet should be used in situations where severe bleeding cannot be controlled by direct pressure or when a limb is severely injured. For example, in cases of deep cuts or amputations, quick action with a tourniquet can prevent shock and save a life. It's crucial to recognize when a tourniquet is needed and to apply it as soon as possible. Applying a tourniquet correctly is essential for its effectiveness. For a commercial tourniquet, first position it above the wound, ideally 2 to 3 inches higher. Then, pull the strap tightly, ensuring it's secure around the limb. Twist the windlass or rod until the bleeding stops and lock it into place. Remember to note the time of application, as prolonged use can cause damage to tissues. For improvised tourniquets, use a strong, flexible material like a belt or a cloth strip and tie it tightly above the wound. Insert a sturdy object to act as a windlass. Twist it until bleeding stops and secure it firmly. Always monitor for signs of continued bleeding and adjust as needed. While tourniquets are highly effective, they come with risks such as potential nerve damage and tissue loss if left on too long. However, in a life-threatening situation, these risks are secondary to stopping the bleeding. It's crucial to seek medical help immediately after applying a tourniquet to minimize these risks. Regular training in tourniquet use is essential for preparedness. Practicing these skills can help you act quickly and correctly when it matters most. It's also wise to include a tourniquet in your first aid kit, especially if you're in environments where injuries are more likely. Remember, being prepared can make all the difference.